All right, welcome to today's Zoom call. We got a bunch of questions that came in, a few reminders to begin with. Always go to our blog. That will help answer some of your questions maybe earlier than waiting for a Zoom call. And on our website, this little feature, if you go to any page on our website, this little thing right here, a little spyglass feature gives you the ability to search for anything. We have a really good search on our site that you can search for your question. We probably have written a blog about it or something, information about your question. If not, that's what the Zoom calls are for. Secondly, if you have any issues with needing religious exemptions for vaccine policies that maybe your work is looking for, or friends or family member that needs a protocol to help detox from a vaccine or exposure to those that are vaccinated, we ask that you go to our sister site, myhopeforlyme.com, and on the blog, you'll see blog posts that detail information on this very, very stealthily. So My Hope for Lyme is our sister site. Go and look on that. Okay, let's get to your questions. Number one, has anyone with pancreatic cancer stage 4 done ozone therapy, and what success have they had for that? Ozone therapy is a beneficial therapy for a number of things. So ozone can be done rectally, rectal insufflation of ozone. It's where you use an ozone machine to fill up a certain content of a bag, and then you, just like a coughing enema, you put the tube up your bottom and you'll empty the contents of the bag of ozone, which is a gas, O3, into your rectum, and you absorb some of that. It affects you in different ways. There's ozone that can be done via the blood. So an IV center may use ozone that ozonates your blood. There can be benefits to that as well. Do I recommend ozone therapy for cancer? No, I don't. Different practitioners have different thoughts about that. Personally, I don't like ozone for cancer. So ozone is O3. It's an unstable molecule, and the one oxygen will break off and leave an O negative molecule and a molecule of O2. That's the whole idea. That's a benefit of ozone. So it's an unstable molecule. It will break off that other oxygen. And the benefit is if you're trying to deal with biotoxins like mold, for instance. That's why I'm a big fan of the ozone generators that are the air purification generators. You're putting a small amount of ozone out into the room. You can smell it through those ozone generators. We have 2 of them in our clinic. And the O3 goes out of the room, and it's fairly unstable. It tends to donate that oxygen to a living organism, like a mold or a bacteria or a virus, and it will then make that less stable and kill that bacteria or a virus or mold. So where I think ozone therapy shines in human use, using it intravenously, getting it into your body, is if you're dealing with chronic Lyme, chronic mold, chronic bacterial infection, something like that. And I'm not to say that cancer patients don't deal with that too. So if you're a cancer patient that has a major problem in that area, that's where ozone might be something to look into. However, ozone is giving off that oxygen molecule that is a negative ion. So it's an ion. It is, by definition, a reactive oxygen species. It is an oxygen. It's not oxygenating, like, oh, it's giving us more oxygen. It's actually giving us reactive oxygen species as well. So that can be cell damaging. So with those air purifier units, you're breathing that ozone in. Is it bad for you? No, in that concentration, it's not. You can't hurt yourself with those air purifying units unless you turned off the setting where it senses too much ozone and you locked yourself in a closet with it, you breathe it in, you could damage your lungs. But at the setting that you can run at the highest setting, you still can't damage your lungs. You're not getting enough ozone. But if you're putting ozone in your blood or even rectal insulfation of ozone, you are creating reactive oxygen species, which to me, that's what all the nutrition you're taking, all the things you're doing with the Rife is you're trying to decrease reactive oxygen and nitrogen species to help heal cancer. Those are the things that can cause cancer. So I'm not a big fan of ozone with cancer. We could talk for a while about that, but we'll leave it at that. Somebody chatted in, how do I get in touch with someone to adjust my protocol? Please just call the office. If you send an email and you don't hear back from us within a couple of days, unless it's on the weekend, you need to call the office. Again, we literally get 200 emails a day. So it could have gotten buried. It may have not ever come to us. We have people that say they sent us an email and actually sent it to con@orsclinic.com. Well, we never received it. So make sure you call your liaison, call the clinic, ask to talk to your liaison, and we can work through that. You could also email your liaison. Okay, next question. What is the maintenance protocol for fenbendazole? That's the Joe Tippins fenbendazole protocol. We have blog posts on that and we have it on the store. If somebody's PSA is 0.07, my coworker's PSA was 20.4 in June, who's told to call hospice. He started on the FenBend starter pack in September, and now it's down to 0.07. That's fantastic news. Great to hear that. Now, typically the maintenance dosage is to your comfort level. Now, I can't give you any specifics. This person is not our patient. So when you guys send in questions, be aware that there's just legalities. I can't answer a question that's of somebody who isn't our patient and signed agreements and things like that. But in general, any maintenance doses of any supplement or treatment protocol, you just cut it in half and then maybe half again. You still would want to stay on some degree of treatment to a point. If you're out a couple of years and you're doing fantastic, maybe you wouldn't take any fenbendazole. Maybe you would just pulse it. Maybe you take it for a month and be off for a month, something like that, every other month or every other week. That's called pulsing. There's some benefit to that too. Next question, is it okay to do the Rife or Ion ProWave while eating a meal? And a follow-up, is it okay to do it while talking on the cell phone? The answer to both of those is yes, you can do that while eating, talking on the cell phone, while we just don't recommend doing the Ion ProWave while you're dancing. Don't do the Ion ProWave while you're dancing. I tried it and I sprained my ankle. Next question, if my cancer is slow growing, will it also be slow to die? The answer to that is no, not necessarily. There's no correlation to a slow growing cancer to a slow dying cancer. Everything is going to happen at its own pace. So there's no way to correlate that. But anything is possible. There's just no way to correlate the equality of that. Next, I'm considering Care Oncology's program. So if nobody knows, so Care Oncology's program is a program to use prescription medication to help block metabolic pathways. We don't use that because we don't write scripts. So we have a number of patients, handful of patients that are doing some sort of Care Oncology's program. Some of the drugs make sense to me because there's very few side effects of that drug. But some of the drugs make less sense to me unless you're in dire straits because there's a lot of negative side effects to that drug. So it depends on what drug they're using. And follow up to this question, my doctor says he doesn't think I'll benefit from a couple of the 4 drugs. What do you think? Well, there's no way that we could tell unless we were testing you with those drugs. And then we have to be careful testing with drugs just because of legal stances. Have we seen success with those drugs with any breast cancer patients? Off the top of my head, I can't give you an answer to that because I don't honestly remember. We have nobody doing, nobody that started this, we're working with us, then started Care Oncology, and then they had, this spike in success. I'm not saying it didn't work, but we just haven't, nothing that I can recall. A few months ago, during a Zoom call, we briefly talked about the solfeggio frequencies, and you encouraged us to look into that. Pretty much everything I see is related to sound frequencies. Yes, that's true, because those are in the lower range hertz, and you can play those with sound. Matter of fact, there's the details on the solfeggio frequencies has to do with healing frequencies and using, I think, the sound of bowls, where they rub their hand around a bowl. But any frequency you can still use with light. So the Rife machines use solfeggio in what I program. So I program the solfeggio frequencies into the Rife, and it's in many of your programs already, and you just don't know it. I know part of my confusion probably stems from not understanding the difference between light frequency and sound frequency. So there's benefit for both. Some things, depending on what frequency is, you can't get it with sound because it's outside of the sound spectrum. But the solfeggio are all lower hertz frequencies that you can get in the sound spectrum. There can be benefit to using both. So I think you could actually probably on a YouTube channel find the solfeggio frequencies sound-wise and play them on with a good speaker system, and they can be beneficial. So, how many weeks after completion of chemo should I continue PEMF therapy? So, the answer is we have people that are not doing PEMF at all. So, and we have people that have a home PEMF that are using it every day. So it's really up to you. PEMF therapy is really meant to add charge to your cell membranes. That's really how it benefits. Now, it has been shown to help decrease pain, but it does so by stimulating a certain pathway that inhibits then the pain pathway at the cord, to get too neurological. But it does so by adding charge to those neurons. So you're adding charge to cells that have low charge. That's the real benefit of PEMF therapy. So PEMF therapy doesn't kill cancer cells, doesn't heal, but it helps stimulate cells and the health of cells. So the longer you could do and the more you could do PEMF therapy within reason, I'd say daily, is great. There's no downsides to it. So to answer this question, as long as you can do it or fits into your schedule or fits into your budget, to continue to do PEMF therapy. So I assume you're going to a clinic for this. So PEMF therapy just has so many benefits. Are there certain things like RSO, which is Rick Simpson oil, which for those who don't know is very, very concentrated TSH of marijuana. So are there certain things like RSO, detox supplements, or other supplements that I should refrain from while doing chemo and radiation? I know I need to not use colloidal silver. So there's some things you want to stay away from with radiation. Chlorella, blue-green algae, colloidal silver. Those are really the most common things that you stay away from if you're doing radiation. With chemotherapy, that's a different story. So chemotherapy is a strong poison, an oxidizing agent. And that's how it works. You're oxidizing cells. So If you drank a poison, you would die if you had the lethal dose of the poison because of the oxidizing of your cells, destroys your cells and it causes cell lysis and you die. With chemotherapy, it's the same thing, but they're giving you a controlled dose so it doesn't kill you. Hopefully, the cancer, because it's highly metabolic, more metabolic than a healthy cell, it's going to uptake the chemotherapy faster than a healthy cell, and we're going to kill the cancer cell through that oxidizing agent. So you don't want to take antioxidants while you're doing chemo because you're kind of defeating the purpose. You're negating a portion of the chemo by using an antioxidant while you're taking an oxidant via chemo. So, but really, chemo does its work on the cancer within the first 48 hours, and then you want to jump on some antioxidants to help counteract what the chemo would be doing to your body. So, our chemotherapy protocol is on our website on a blog post, or you could ask your liaison for it. But we recommend that you go off any strong antioxidants, alpha-lipoic acid, anything that's going to strongly stimulate glutathione production, maybe stay off of curcumin, vitamin C, while you're for that first 48 hours of chemo, and then go back on those things because you don't want to negate the effects of the chemo. We also recommend if you're on, some detox support for your liver, it might be good to hold off on that because you don't want the chemo to detox too quick either. So we recommend you go off of things like Liver ND or some milk thistle, some products for like PON1. You might want to back off on that. Now, there's other people that have a different theory about this too, to just understand that's the medical theory. And so I'm not opposed to medical theory, and that's what we stand by. But there's other practitioners that say, baloney, you need to use antioxidants and to protect your healthy cells during chemo. So there's some individuals that will completely go 180 degrees against what the oncologist says, and they'll double up on the antioxidants during chemo because they want to protect your healthy cells. Well, to me, that's counterintuitive a little bit, because if you're choosing to do chemo to kill the cancer, well, you want it to work. You don't want to negate any of the possible benefits of chemo. So we recommend that you go off your antioxidants for 48 hours and then go back on them. Since upping my coffee enemas to once a day, most days, I'm finding that I don't have a normal bowel movement independent of those enemas, almost like I'm training my body not to eliminate unless I've got an enema. There's truth to that. So if you're doing a daily coffee enema, yes, you are training your body to rely on those enemas for a bowel movement, and that's a negative. But the positive is you're doing a coffee enema to stimulate parasympathetics, to stimulate detoxification, to stimulate immune system function. Remember, your parasympathetic nervous system controls all your immune system function, all your detoxification, all your rest and relaxation, anti-anxiety, calming your sympathetics, calming your heart, opening up your blood vessels, opening up your brain for decreased inflammation, has so many positive benefits. If you go off the coffee enema, yeah, it might take you a week to really get your bowels back in habit. You can certainly take magnesium and Cape Aloe and senna and other things to get you back into the habit. So there's too many benefits of a coffee enema to worry about, oh my gosh, I'm dependent upon this. What most patients do is they have those other products, they're listed in your constipation know-how sheet, that, let's say I'm going to go on vacation, I'm not going to do a coffee enema this weekend, and I know I get a little constipated if I don't do that, so you're going to take vitamin C and magnesium every night. at a dose that will really help you have a bowel movement the next day, or Cape Aloe or something like that. So there's too many positives for the coffee enema. When changing breast surgeons, and during our discussion, she stated her preference for an MRI to assess breast health. She prefers it because it gives a dynamic picture of what's happening with breast tissue, in contrast with the static images produced by ultrasound and mammogram. I find that kind of a funny comment because an MRI is still a static picture. And certainly if you want something that is more dynamic, you'd have to say, the argument would be that ultrasound out of those three would be the most dynamic because you're moving the head around. You can actually see three-dimensionally around the ultrasound. But anyhow, when I asked why this is important, since we're looking at tumors, she stated that breast cancer is more than just tumors, which is true. You got inflammation around it and such. She said the images of the uptake of the dye by the breast tissue and its movement through the breast is important information. Sure, that is good. So I'm all in favor of MRI, CT scan, PET scan. The negative is that they are invasive. So you're using a dye, which is gadolinium in MRI. Gadolinium is a heavy metal, and some people have a sensitivity to it. And the more you do MRIs, the more chance that you're going to develop a sensitivity and have issues with the gadolinium in itself. So it's just more invasive. So again, I'm not against invasive tests, but you do an invasive test if it's going to change the way you treat the patient. And you choose to do an invasive test as a patient if you're going to and willing to change the way you treat yourself. You allow somebody to treat you. So if you're like, oh, this tumor is getting larger, I'm more concerned, then maybe it's time to do an MRI because maybe you're going to change your treatment program. Maybe you're going to add some chemo. Maybe you're going to tweak some other things. If things are going well, the ultrasound showing the tumor staying the same size or hardly growing at all, then and you're not going to change the way you treat it, then why do an invasive test? Just to satisfy curiosity of some doctor. You don't do that. You don't do something to please somebody else. You do something because it's the right thing for you to do. And this is where you have to take charge of your health and make that decision and not be pressured to do something that is not what you want to do. Certainly, if it is what you want to do, go ahead and do that. If it's going to change the way you treat it, then go ahead and do that. Just be careful of how many invasive tests you do because there's negatives to it. So. Okay, with that, we'll open up for questions. If you want to chat in your questions, if you have any, if you want to speak in any questions, you have to unmute yourself.
Hello.
Hello.
Hi, this is for Ryan Grasher. So you had talked about fenbendazole. Is there any negatives to taking that while taking chemo and radiation?
I can't legally say that about taking it while taking chemo and radiation from just a medical legal standpoint, but no, there is, you could Google Scholar search yourself. There are no studies on that at all showing any positive or negative. So all the positive information about fenbendazole, actually, I think there are some studies showing positive information about ivermectin and fenbendazole for cancer treatment, but there are no negative ones. So are there anecdotal, clinical data negatives for taking fenbendazole? So the most negative comments that you get for taking fenbend is maybe a mild stomach ache if you add some food when you take it. For goodness sakes, people have a mild stomach ache for taking vitamin C too. So it hasn't stopped anybody from taking it. So there's not, it's like kind of like ivermectin, there's really not a downside to it. And something that it should be used more commonly. All right. Next question, chaga mushroom question. How much powder should I use per smoothie? A teaspoon, a tablespoon? I would use a teaspoon. Um, if you're doing one smoothie a day, you could use a little bit more. But you're getting a lot of polysaccharides and benefits from um, a teaspoon, because I know you're talking about a young adult, the question is. So for an adult, you could do more than a teaspoon, but if you're doing other mushrooms, other polysaccharides, there doesn't, you don't need to overdose on it, because all you'll do is you'll just pee it out. So you don't want to necessarily overdose on it. So with the person who asked this question, I do a teaspoon. FedMed, can it be used for brain cancer? I don't know. I do know some people who have used it for brain cancer and have had success, but they're doing other things too. So I don't know if it was the FedMed or not. I don't know the data on whether fenbendazole crosses the blood-brain barrier. But the truth is that most people with brain cancer have been on enough drugs that have already damaged the blood-brain barrier. So most likely, if you had fenbend circulating in your blood, it would cross the blood-brain barrier. So there's already damage to the blood-brain barrier. So it would probably cross. So there's some medications, some larger chemicals and stuff that you have a barrier made up by a certain group of cells called astrocytes that surround your blood vessels that go through the brain, and they protect your brain from receiving any of those large chemicals. That's called your blood-brain barrier. It's not developed till you're about 3 years old. That's the danger of giving vaccines to children. Vaccines have different things in them that help the vaccine work. And those are very toxic chemicals, not to mention the mercury and the aluminum in there. But those things readily cross the blood-brain barrier in a baby less than 3 years old because they don't have a blood-brain barrier. So that could cause all sorts of inflammation and damage to the brain, and neurological centers that are just developing. It's just horrible and disgusting, and it's a sin. That's my opinion. As we age, you're taking flu shots and things like that. These are micro doses, nano doses of aluminum, which then they say is safer for you. The truth is they're actually more dangerous. So a nanoized particle of aluminum is much more dangerous than you sucking on some aluminum foil, because that then easily, readily crosses the blood-brain barrier and causes all sorts of damage. So it's even worse. All right, next question. I may be having Doxil chemo for 6 days, then a day of bladder protecting, then a day of the last total of 8 days. I assume I would wait 48 hours after all of this. Correct. So my opinion would be after all of that, then you wait 40. So then you're going to be off, total of 8 days, you're going to be off antioxidants for 10 days. So you wouldn't be taking alpha-lipoic acid, you wouldn't be taking curcumin during that time, you wouldn't be taking vitamin C, and just contact your liaison for a list of antioxidants, or you could just Google a list of antioxidants. And you really want to just stay away from those strong antioxidants. A lot of nutrients have antioxidant benefits to them that you don't need to so much worry about. It's just taking high doses of alpha-lipoic acid or vitamin C that you'd stay away from. Any other questions?
Hey, Dr. Connors,
Yes.
what's the benefit of the hyperbaric chamber after chemo?
So the hyperbaric chamber is pressurized oxygen. So it helps pressurize oxygen into your tissues. It's different than ozone because it's O2 that you're pressurizing. It's not O3. So you heard my spiel earlier on O3. So, and so it's not oxidizing, it's oxygenating. Very different.
Okay.
So, yes, oxygen is in O2 form is very good for your brain. It's very good for your other tissues, but I really think the key piece of hyperbaric is for brain health.
Okay.
So your brain needs fuel, and the fuel your brain uses is glucose and oxygen, period, nothing else, glucose and oxygen. So you need both of those for brain function. So using it post chemo is really to help with the damage that chemo did to your brain. So if a person is using chemo for breast cancer, still that's circulating in your bloodstream, pretty good chance you have some damage to your blood-brain barrier. Some is going to cross the blood-brain barrier. The longer you do chemo will damage the blood-brain barrier itself. So you'll get some that crosses. This is where you get the brain fog, the chemo brain. People have worse chemo brain than others because they had a worse damaged blood-brain barrier. And then that in itself will cause problems in your brain because it's going to damage microglial cells, damage neurons, etc. So increased oxygenation helps the brain heal. So hyperbaric chambers are great. The negative about hyperbaric chambers is you have to do it fairly regularly. So all the studies on hyperbaric chambers are doing it daily. So it would be best if everybody had their own hyperbaric chamber. The other negatives are people with sinus issues like mine can't go in them. People that have claustrophobia issues can't go in them. So it has some negatives, but it's a great tool.
Okay. Have you had any experience with anyone taking Cantron or Protocell?
I'm sorry, say that again.
Cantron or Protocell?
Well, yeah, we use Protocell. So that's something we test everybody for.
Oh,
So
okay.
we have a number of people probably on this call that are taking Protocell. So
Okay.
Protocell is a great tool. Protocell is different than all our other therapies because Protocell is an oxidizing agent. And you don't want to take a lot of antioxidants with Protocell. You have to take them in between the Protocell dose because Protocell, whether you're using Protocell 50 or Protocell 23, it's about 4.5 or 5 hour dose. Every 4.5, 5 hours, you got to take a dose. You have to take it. All your other supplements in between that.
Okay.
It's a little bit of a hassle that way. But
So if I've been tested and that means I didn't get it on my sheet, then it's probably not going to be good for me.
correct.
Okay.
Correct. And I don't remember how long ago you were tested, but you can always ask to be retested and specifically tested for that, but we test everybody for that. So,
Okay, good to know.
next chat question, there may be nausea associated with chemo. Ideas to help would be appreciated. Yes, there's typically nausea associated with chemo for many reasons, or for two big reasons. One is it affects your stomach and causes an upset stomach. But secondly, if it's crossing the blood-brain barrier, you actually have a nausea center in your midbrain, part of the mesencephalon, and it's part of the deep midbrain. So if chemo gets there, that can be causing serious nausea. So we have a product that's an herbal from Herb Farm that's called Not Now Nausea. That has helped people with nausea from chemo or nausea from cancer have been helped with ginger. Some people have used ginger chews. You can buy those in your local grocery store. They're just tasty little snacks. They do have sugar in them, but they're a lot of ginger. They're very gingery. A lot of pregnant women will use those. There's an essential oil ginger that you can use. When I had really bad nausea, I used a product called Digest. It was from Young Living. Other essential oil companies might have some similar products. That helped me, just putting a couple drops on my finger and putting it on my tongue. A lot of my patients, other patients have used Digest or ginger. That has helped. Next question. The Greens First powder has antioxidants. I'm also taking a multivitamin that has 90 milligrams of vitamin C. Those would all be acceptable during chemo. So 90 milligrams of vitamin C is really low, and the Greens First is all whole food. So taking a whole food powder like that, to me, I don't care what your oncologist says, that's not going to negate your chemotherapy. So you should still be taking, I suggest you still take those things. There's not enough in there. It's all in a whole food form, like you're eating really good food. Are you not supposed to eat food when you take that? So I'm not talking to you who's asking this question, but I'm talking to the oncologist that's arguing with this question. So no, just continue to take those. Those are just fine. Are there other recommendations different from the standard chemo radiation detox you provide for brain cancer? No, you can reach out to your liaison for that, but to detox chemo from brain cancer, I think that's what you're talking about, detoxing chemo and radiation that you're using for brain cancer. No, it's really no different. The only other things that I would say is to, when you're done, the chemo that they're using for brain cancer is chemo that they're purposefully getting to use to cross the blood-brain barrier. So, and then any radiation to the brain is causing damage to surrounding tissue as well. So there's a video on our blog. If you search our blog, you search brain inflammation. I created a video on microglial activation that I think will be helpful. It may be scary at the same time for everybody, but I think it's helpful for everybody because understanding what things cause damage to the brain that leads, we're not talking just about chemo or anything like that. We're talking about just the average person that is concerned about early dementia, brain loss. I don't want to have Alzheimer's like my mother. Really needs to watch that video because Alzheimer's, dementia, any other type of brain demyelinating disease really starts with some sort of damage to the brain and how the brain actually cleans itself, how the brain protects itself, and how you now learning those things can support that. So your brain gets rid of pathogens, gets rid of toxins, helps heal cells through specific glial cells called microglial cells. And I won't go too deep into it because I have a 25-minute video on it. But those microglial cells can get damaged. Certainly when we do chemo, certainly when we do radiation, they get damaged more commonly in the general public from post-concussion, even falling and banging and hitting your head. 10 years ago, 20 years ago, when you were a kid, ice skating, you fell and smacked your head against the ice. Who hasn't done that in Minnesota? So those types of post-concussive damages damage microglial cells. Years later, decades later, you start to see the effects. Now there are specific nutraceutical things that you could do to push dementia out and help heal the brain. The people just aren't doing it. And this is well-researched, well-documented information. And the research has been pouring in after the whole post-concussive syndrome with football players, just poured money into research into this. And it's all coming down to really hitting the flavonoids hard. The flavonoids are your resveratrol, your curcumin, your white willow bark, your anything you could think of it as an anti-inflammatory agent. The more you can help decrease the inflammation of the brain by calming down activated microglial cells, the better you can heal your brain and the more you can push off dementia into the future. So watch that video. Go on our website again, and remember that slide right here. Search for brain inflammation. Everybody watch that video. If you have any concerns of any chemotherapy, radiation affecting your brain, how you can help protect it from that point on, or you have any concerns of, I don't want to get Alzheimer's, my uncle had Alzheimer's, my mother had Alzheimer's, whatever it is, you need to watch that video and to learn how you can take care of yourself, because it's actually pretty simple steps that you can do, and you can really prevent a world of hurt. And the more damage there is to your brain, and the more what are called primed microglial cells that you have, they don't go back. So you can protect them now, you can help a lot of things. So yeah, I would just look at that video and use some of the recommendations in there. Sorry, I get a little wordy on my answers. Is it safe to take anti-inflammatories during radiation? Yes, and yes, and yes. So you want to decrease inflammation during radiation. So radiation is a beam of frequency that is going through your brain, damaging cells. So the more you can protect from the inflammation, you're not affecting the radiation negatively. You're protecting your healthy cells from the inflammation that's caused by the damage. Think of a beam ray that's going through there and zapping things. Well, you're zapping healthy cells and you're causing all sorts of inflammation. So the more you can do to protect that, the better. My brain is swelling, probably caused by the radiation therapy, causing neurological symptoms. My oncologist has prescribed me steroids to reduce the swelling and help the symptoms. Is there anything you'd suggest to reduce the swelling? Yep, go back to my last answer. So yes, steroids are really the right thing to do, because with swelling in the brain, there's no place for it to go. So it could damage your brain. You cause seizures and all sorts of things. So going on a low dose, probably on 2 milligrams of prednisone, maybe twice a day, is the right thing to do for a period of time, but you don't want to stay on it the rest of your life. So the more you can jump on these things that I just mentioned, these flavonoids, those are those anti-inflammatory things, the better off you're going to be. High dose curcumin, boswellia, white willow bark, stinging nettle, betalain from beets, that betalain limitless product, the resveratrol, the green tea extract. Those are the things that are going to save your brain, that are going to calm that inflammation down. So don't be afraid to take fairly high doses of those things. Remember this with all your supplements, please. All those supplements except your fat soluble supplements have a half-life in your body. So if I'm going to take curcumin for my brain, and I'm supposed to take 4 grams of curcumin. If I take them all at 7 o'clock in the morning, well, by 3 o'clock in the afternoon, it's pretty much all gone out of your system, or really the therapeutic dose is. You have to split them up through the day. So they have a half-life staying in your body. So your body resorbs that, gets rid of it, detoxifies it, like anything else. And you want to keep a therapeutic dose within your system. So you want to break that dose throughout the day. CT scan done about 2 years after prostatectomy. There seems to be more action on the scan in the area where the surgery happened. Very common that after removing your prostate, in what's called the bed of the prostate, where that prostate sat, that there can be cancer that can take place after removal, even though they think they have it all gone. That's why you're doing the things that you're doing. You concern is that cancer is growing there. Yes, that's always a concern. Some action now in the lymph nodes. Should my protocol change if I choose to go on androgen deprivation therapy? I don't know your whole protocol, but one thing you always want to add to androgen deprivation therapy, so it's taking like a Lupron or something like that, or Casodex, you want to start Andrographis. So Andrographis is an herb. We use the product ViraClear. That's our product that we have labeled for viruses, because Andrographis is so good for viruses. But there's been studies shown that if you're on androgen deprivation therapy, which is a drug that decreases your testosterone significantly, it will work better and it will last longer if you're coupling it with Andrographis. So get on ViraClear. You can buy that in the store, and just start taking that, like 1 capsule 3 times a day of ViraClear. Yes, I saw the direct message. Make sure you call the clinic and set up an appointment to chat with your liaison or myself or Michelle. So make sure you get on ViraClear right away for androgen deprivation therapy. Okay, any other questions? All right, I think we'll call it a night. It's been about an hour. Thanks everybody for being in. Okay, so one more question back to the MRI question. Could the MRI show something the ultrasound can't? It's possible. Anything's possible. So if you're concerned that something is not right, again, you have to have some faith and trusting what you're supposed to be doing. So be praying about whether you should move to the next step and do some sort of MRI or not. That's the choice that you're going to have to make. Anything is possible, and it could show something different. So if you feel that concern, maybe that's the leading to do that. All right, thanks everybody. We will see you next week. And again, remember to email questions in if you want them answered. We'll do our best to get them. And we'll be praying for you all. Have a great week. And I won't talk to you before Christmas. So everybody have a very Merry Christmas. And I will be back after Christmas. Michelle will be doing next week. All right, bye-bye.